Okay, this is chapter 31 from the book Medical Reformation, and the topic for today is more detail about atherosclerosis and heart disease, coronary artery disease. Okay, well, first of all, I just want to let you guys know, I don't know if you know this, but I have a congenital heart disease, dextrocardia. My heart's in the right place. I also had an arrhythmia disorder that was very frustrating, especially during the teenage years. I couldn't dance. I was having some chest pain recently, and in middle age, and I decided to go to a cardiologist, and he told me I had to go for a stress test. He put me in the kitchen with my wife and mother-in-law for 1 hour, and I had to follow all their rules. It was very stressful. Okay, another thing to be aware of is that, exercise is good, but you can't outrun a bad diet. Alberto Salazar is like a Boston Marathon champion and other marathon champion races, one of the best in the world. He had a myocardial infarction, nearly died. He basically did die. He had to be defibrillated and resuscitated. So it doesn't matter how much you run. And there's other famous marathon runners like Jim Fixx. There's the super trainer guy on Biggest Loser TV show, Bob Harper, who, Jim Fixx died of a myocardial infarction when he was only about 52 years old. Albert Salazar, I think, was 48 when he had his near-fatal myocardial infarction, something like that. Bob Harper was in his early 50s as well. So yeah, it doesn't matter how much you exercise. If you plug up your arteries with a high-fat diet, you still have problems. And some people ask me, oh, well, what about all these people on the internet who say that high-fat diets are okay, they're good for you? Well, I would say they're a bunch of liars, or they're ignoramuses, okay? Don't see, a lot of people, you think that the world likes you or cares about you or the medical system. No, it doesn't. You have to understand something. The basic system, the way it works, the big money, big food, big pharma, they consider the proles to be scum. They don't care about them at all. They would like to simply just take their money, and even worse than that, a lot of times now there's almost like another faction amongst the ruling elites who just wants population numbers reduced, okay? They really don't care about you, and they're more than happy to lie to you and mislead you and gaslight you, okay? That's partly why I'm making this channel. That's partly why I also prefer the name Medical Monk, because I know the truth about what's happening. And believe me, if you don't go back to Bible ethics, you're screwed, okay? They're always going to do whatever they can to screw you over and rip you off. That's not going to change. Okay, coronary artery is such a big topic. What's the most important thing? Where do we start with this? How do you keep arteries open? And it's kind of obvious. Low fat, low sodium, even better, low protein, 100% whole food, 100% plant food, preferably organic, no nuts, no oil, no seeds, no caffeine, no alcohol. And Caldwell Esselstyn has shown he's got the best results by far of anybody in the world. I have the paper listed down below. It's, the Journal of Family Practice, July 2014. Okay, here's a quote from Dennis Burkitt in Uganda, where he worked for a while. Coronary artery disease was almost non-existent. Where they ate a plant-based diet, maybe 1 out of about 636 patients would die due to myocardial infarction. In the United States, it's about 26% of people die from myocardial infarctions. So yeah, here's the paper, A Way to Reverse Coronary Artery Disease. There's the reference there. Plus, you just go to Dr. Esselstyn's website. It's dresselstyn.com, and you'll see all his papers there and a bunch of his video lectures if you're interested in that. Also, Dennis Burkitt noted in the plant-eating Ugandans and other African populations, almost none of these diseases of abdominal pressure syndrome. Westerners don't eat enough fiber, so they get all the abdominal pressure syndrome diseases, as we talked about in the previous lecture, and as I talked about some of my recent lectures. Nathan Pritikin, he reviewed all the literature on fat, and he basically came to the conclusion all fat is bad. Fat is bad. Okay, Nathan Pritikin was a nutritional genius. As far as fiber is concerned, we probably should be eating, a minimum of 50 grams per day. Burkitt thinks it's normal for us to eat over 100 grams per day. By the way, I eat over 100 grams per day just because I eat 100% plant-based diet, lots of starch, lots of fruits that are high in fiber. Let's see. That's a quote to remember, Nathan Pritikin, fat is bad. And like I said, too, I made videos about it. All fat is bad. There are no good fats. If you get these things through your head, like, why do I say these things? Why am I absolutist about it? Because I want to give you a chance, okay? You don't want to think like an average person. Average people are screwed. They age very poorly. They have terrible outcomes. Awful things happen to them. They get drug, chop, chop, chop. It's bad. That's not your goal. Your goal is not to just be less fat than your cousin. Your goal is to be the best you can be, and that will give you a chance to avoid all this stuff. Okay, Walter Kempner had fantastic results. He had a whole bunch of patients reverse their EKG findings, reverse their their eye exams, their retinoscopy exams with diabetic retinopathy, hypertensive retinopathy. He had patients with congestive heart failure who returned to having a functional heart, cleared up their pulmonary edema. Very impressive results. There's other doctors reporting these things now in the journals. Let's see. And Kempner fed his patients a very low-fat diet. It was in the ballpark of 4% fat, very low in protein. It was in the ballpark of 4.5% of calories from protein. The rest was all from carbohydrates. So you're talking about 92% of the calories or so from carbohydrates, and primarily, complex carbohydrates, from a starch. Nathan Pritikin himself reverses EKG findings by going on a plant-based diet. Dean Ornish had shown that putting patients on a plant-based diet enabled them to, in some cases, partially reverse coronary artery disease. Here's the references, by the way. We talked about Dennis Burkitt before. He was an Irish Christian missionary physician to Africa. Nathan Pritikin's books are really good. I really enjoyed reading them. I feel like I'm talking to myself when I read Nathan Pritikin. Ethelston, besides his research study here on his website, he wrote a great book called How to Prevent and Reverse Heart Disease. Kempner's book is available at drmcdougall.com website. The biography of Kempner by Barbara Newborg, a doctor who worked with him, is very good. I made videos about Kempner. Nathan Pritikin allowed his body to undergo an autopsy at his death and have the results published, and he had clean arteries at autopsy. He had radiation when he was younger that induced a cancer, and that's why he ended up dying. The Ornish lifestyle studies right here, if you're interested in that. JAMA 1998, that was a landmark study. There's been other authors who published stuff about, for example, Armstrong's one scientist who published articles about low-fat diet in primates and that being a way to prevent or reverse heart disease. William Roberts, cardiac pathologist, atherosclerosis researcher, also said the same thing. If you feed high-fat diets to herbivores, and humans are herbivores, they all get atherosclerosis. Okay. The other thing too is, like, if you want to understand something for yourself, just try it. Try it for a couple months. See what happens to your total cholesterol. Get a before and after. Check your weight before and after. That's a way you can test it on yourself for yourself. If you're on medicines, though, for anything like hypertension or diabetes or anticoagulants or something, let your doctor know to titrate the dosages, because your medication dosages will probably change. Okay, what about exercise? It's helpful, but not as important. Esselstyn didn't even ask his patients to exercise at all. He felt they had only a certain amount of willpower, and the most important thing was to get them to eat a plant-based diet. And his rationale was, if you look around the world, populations that eat plant-based diets, they don't get atherosclerosis. So if you just imitate them, you'll probably have the same results. He describes coronary artery disease as being a foodborne illness. He describes the treatments like stents and open heart surgery as kind of not addressing the main problem, okay? It's a dietary disease. The way to treat a dietary disease is to fix the diet. Okay, another skeptical reader here says, well, Pritikin's not an MD. And like I said, Pritikin was a nutritional genius. If you read his logic, when you read his books, it's rock solid, and he gives all his references. Okay, what are the benefits of exercise? Well, exercise will increase insulin sensitivity, which is a big plus. It gets more glucose type 4 transporters to be sent up to the plasma membrane, like in the skeletal muscle, for example, from their cytoplasm vesicles. And that, helps the glucose to get into the cell, because it'll improve insulin sensitivity. That's what you want. After you eat a meal, you want most of the glucose to be taken up in your skeletal muscles, that's floating around in your blood, to be taken up in your skeletal muscles, and it's to be stored there as glycogen. You'll also store some glycogen in the liver to maintain your blood glucose level when you're fasting. It's good to it's good to walk while you're eating. Basically, if I'm home and no one else is home, I'll like to walk around in circles and play an audiobook on a CD player. I find that enjoyable. A lot of times, most of the time, people are home and they're going to get annoyed with me if I'm doing that. So I'll just go watch videos or something on a computer while I'm eating. You could do all three. Walk is a musculoskeletal exercise. To eat is a visceral activity from your intestinal tract. And to listen to the audiobook, that's a cognitive activity. But you can do one of each. They're not, they say you can't multitask, but you can multitask with different bodily systems. You can't do two intellectual things simultaneously and do them well. But that'll really improve your insulin sensitivity. If people are around, it's nice to chat and talk with them. But, most of the time, for most of us, we're by ourselves, so you just work with that. Let's see. Why should a person even bother with this diet stuff nowadays? Coronary artery stents have been improved. Isn't that good enough? I've talked about this before. Dr. McDougall has a real good lecture on it. Basically, coronary artery stents can save your life during an acute myocardial infarction, but most of the time people have chronic cardiac-related chest pain, angina it's called, and they get a stent just because they have a chronic fixed stenosis, and it doesn't increase their lifespan in that setting. Plus, there's diffuse atherosclerosis. William Roberts had shown this, a cardiac pathologist, did over 2,000 autopsies of people who died of coronary heart disease, and he found that it was always diffuse. This sort of legend or myth of single vessel coronary heart disease, he said, just never occurred. It's not true. And when the reason they would say the patient might have single vessel coronary heart disease, there's three main coronaries, was because they weren't able to see the other areas as well on their cardiac cath, cardiac angiogram views. He says when you look at it at autopsy, it's always diffuse. And not only is it in the epicardial coronaries, the big coronaries that run on top of the surface of the heart, you've got all these penetrating branches that go into the myocardium, the heart muscle, intramyocardial branches. And those get atherosclerosis in them too. And you can't tell from a cardiac cath which is the lesion that's likely to cause a myocardial infarction. So you're really not treating the problem of what's going to put them at risk for a myocardial infarction. Okay? And I talked about it. Atherosclerosis is a blood clot. So things that predispose you to having a blood clot, like leaky gut with subsequent bacterial endotoxins, LPS, LTA, getting into the blood, fix your leaky gut to help prevent that. How do you fix that? Eat more fiber, avoid processed food, and the other toxic stuff that contributes to it. I have a whole video of the list of all the things that contribute to leaky gut. It's also in this book. I made a video earlier. There's a whole chapter on that. And like I was saying, most people present as outpatients with chronic symptoms, exertional chest pain, dyspnea on exertion. Okay, coronary artery plaques that progress are usually small, therefore they can suddenly progress to occlusion. You can't detect them on cardiac cath. Okay, so there's no good way to preemptively treat the likely future causative plaque with bypass or stenting. It just doesn't work. So it's not gonna minimize it's not gonna change your lifespan almost certainly, unless it's an acute myocardial infarction situation. Okay. The word for narrowing in medical terms is stenosis. So a 70% narrowing in medical terminology, that would be called a 70% stenosis. And usually at autopsy, the stenoses and the atherosclerosis severity is worse than it is as cardiac cath. Cardiac cath underestimates things because it tends to compare one abnormal area to another rather than a normal area to an abnormal area. Actually, the best paper in the history of the whole world on coronary artery disease was written by William C. Roberts, and it's called Quantitative Extent of Atherosclerosis in the Major Epicardial Coronary Arteries at Necroscopy. So what that means is he measured the amount of stenosis, the amount of narrowing from atherosclerosis in the big coronaries, the ones on the outer surface of the heart. Those are called epicardial. Outer part of the heart is called epicardium at necroscopy, at autopsy. So it's a pretty definitive study. There's around 2,000 of them. And he basically showed it's always diffuse. That's a major finding, by the way, because what it basically points out is that the whole single vessel common way of looking at things is incorrect. If you know what's going on with coronaries, I made a video recently I was kind of joking about the 5 wounds of Christ, or like the 5 wounds of the village idiot. That once you understand coronary artery disease, to go for anything else than low-fat vegan diet is basically stupid for chronic coronary artery disease. It was over 2,000 autopsies. Severe stenoses are never isolated to one location. Isolated single vessel coronary arteries. These are all sayings by William Craig Roberts. He said, William C. Roberts, isolated coronary single vessel coronary arteries is a myth. It's always diffuse, always diffuse, always diffuse. That should ring in your ears, because what that's saying is it's always a diet problem. Always. Okay? And so we'll just leave it at that. That's really worth knowing. It's always in multiple locations of similar severity. Okay, the adjacent segment is not normal, even though it seems to be to a cardiac cath doctor. Okay, a 50% stenosis at cardiac cath was typically about a 75% stenosis at autopsy. Meaning, and stenoses are usually not flow limiting until they're 75%. So what that means, if it's 50% or more at cardiac cath, then there's a good chance it's flow limiting. It also means it's impossible to completely treat stenoses with stents or with surgery, because the coronary artery disease is significantly worse at autopsy than it is at cardiac cath. And you end up also playing a game of whack-a-mole, and there's an infinite number of moles to whack. And you can't effectively stent distally. You can't effectively bypass into real small arteries. So the stenting and surgery is really for narrowing stenoses in big arteries. There's also sometimes problems with branch points, making it difficult to plug in or to stent something. So you're just not going to win the game, with stenting or bypass for coronary artery disease, just a fact. And you can take all these drugs, statin, anticoagulation, and all this stuff, but why not just fix the diet? That's going to work better, most likely. That's going to address everything, not just the epicardial coronaries. It's going to address the intramyocardial coronary artery branches and the small parts of the epicardial arterial system. Okay, so like I said, standard of care sounds good, but standard of care is really for chumps in this case, because optimal care is low-fat, low-sodium vegan diet with no oil. Okay. And statins have side effects. They're mitochondria inhibitors. After a stent, you got to take blood thinners. That's a pain in the butt. Open heart surgery is a big deal. There's a potential for a lot of side effects, including cognitive impairment. Let's see, what else? Well, Esselstyn diet has far, far better results. Esselstyn had 99.4% of patients with no recurrent coronary or cerebrovascular events on 4-year follow-up. Those are incredible results. There was some optimized version of the Mediterranean diet, and it was like more than 30 times better than that. That's extraordinary results. So basically, all you have to do is eat the low-fat plant-based diet, and you have like a better than 99% chance to never have a coronary artery problem again, or at least for the next 4 years, which probably means forever. So, I mean, in life, you'll hardly ever get a better deal than that. And I'm not aware of any side effects from the vegan diet other than, you got to take a B12. Whoop-de-doo, that's not too big of a deal. So anyways, I think we're going to call it that for today. This will be 31A, and I'll do 31B on a follow-up lecture. And like I said, Esselstyn says the problem with stents and surgery is they don't treat the problem. So you've basically left the number one cause of death untreated, in a sense, because you haven't addressed where the likely plaque is to rupture and clot off the coronary. So anyways, I hope that was helpful. I'll make a 31B sometime soon, probably tomorrow. Okay, thanks.